Okay, thank you and good afternoon, everybody, and welcome to the Pandemic Task Force briefing. I hope everyone had a great day so far and had a fun and safe holiday weekend. I wanted to thank everyone for doing their part this weekend. I know that the holiday looked a little bit different with limited gatherings and firework displays, but by limiting large gatherings, we can help prevent the spread of the virus, which will in turn help us get back to normal faster. So we're continuing to monitor the spread by following various pieces of data, including our hospital admission data. And I would like to share that with you now, and then we'll get to some questions from the media. So here's a chart showing our hospital admissions data, and we're continuing to see that curve bend upward, which is not what we would like to see. We did see a decrease, however, in the number of admissions today, with 14 new admissions compared with 23 yesterday, so that's good news. But as we've said all along, we follow the trends, and so the overall trend, which is the blue line, as you've become accustomed to, is going up. So our 7-day moving average stayed at 21 for the second day in a row, which, as we've remarked before, that's the highest that it's been in a month. And again, this chart looks at hospital admissions of confirmed COVID positive patients from early April through today and has a lag of 2 days. Also, as we've said before, we know that we won't be at zero for quite some time. However, we become concerned when we see these upticks in admissions consistently over time. Next is our hospitalization data. So these numbers continue to show an increase as well. Now, since these are larger numbers, you're not going to see that dramatic rise like we have in the admissions number, but it is definitely going up. So this chart represents our daily hospital census of COVID-positive patients only, and today's average sits at 156, which is up from 145 on Friday when we last spoke. And last Wednesday it was at 139, so you can see how that number continues to climb. Overall, our hospital census climbed today as well. It's at 167. So let me update you now on some of our hospital numbers. And again, these represent our COVID positive patients only. They don't include the patients that were suspected of being COVID. As I mentioned in the previous slide, we had 167 hospitalizations today of confirmed COVID patients. We have 40 confirmed COVID patients in our intensive care unit, and we have 23 confirmed patients on ventilators in our hospitals. So let's take a look now at some of our suspected COVID patients. And again, these represent people that we're waiting on the test results to come back from. And so we have 106 people that are currently being evaluated for COVID in our hospitals. We have 9 that are in our intensive care units, and we have 3 that are on ventilators. And as usual, it's time for our good news slide. Yesterday, our task force healthcare systems discharged 13 additional COVID patients, and that brings our cumulative total to over 3,000, which is quite a milestone. So we're at 3,002. And again, this is a testament to all of those healthcare workers out there who have been working so hard to treat the COVID patients and get them back home to their loved ones. So thank you, everyone, for that. So as we've done in the past, we show our modeling numbers and how we're doing compared to those models. So if you look at these charts, the black line is our actuals. And so this is our inpatient hospital data is the black line. The blue line is our best guess. The orange line is a slow decline in cases, and so that's if we calculated that the transmission rate was going to be higher, that it would be a slower decline. And of course, that red line, as we discussed previously, was what would happen if there was a second wave or if there was a really increased transmission. And as we've said before, our actual cases have followed along our model pretty closely. However, they seem to have moved now from our best guess scenario up to our slow decline, which we kind of figured it would just from the relaxation of our shelter-in-place rules, more people interacting. That means there's going to be more transmission, which means there's going to be more inpatient cases. We're still continuing to move along at that slow decline. We'd like to see it come down, but it's tracking fairly well with our models. The next one is our ICU census, and again, it was tracking along our best guess line, but it's now more consistently following our slow decline line, which again means that we had some increased transmission from where we were before. It's not to be unexpected from the relaxation that we've had in some of our opening of businesses and things like that. Again, hopefully we can get this number down again with interrupting transmission from instituting mask wearing and things like that. Now this next slide shows the epidemiologic curves from the different counties that make up our statistical area. And as you can see, a majority of them are ticking up here on the latest dates that you see, which are on your right-hand side. So the dates flow from left to right. Now, some of the numbers you'll see, or some of the graphs you'll see, are a little bit jumpy, and that's because those are usually the smaller counties, and so any one case can make that graph go up and down fairly rapidly, or you get these big jumps. The higher population counties you'll see are a little bit more smooth, but as you can see, most of them are ticking up in the cases, and so again, it's concerning that we have increased transmission. We're seeing increase in cases, increase in hospitalizations, and so we need to do everything that we can to interrupt that transmission. And then lastly, showing you what we've talked about before, which is the reproductive factor. So you've frequently heard me call it the R naught, but after the initial, we call it the reproductive number, or the RE. And again, we want to keep this number below 1. And so what that means is if it's above 1, that a person with COVID is transmitting it to another person. If it's below 1, then they're not. And so in looking at these numbers, almost all of the areas, if not all of them, are now above 1. Now there is what's called a confidence interval that says it can be between these two numbers, and so we're hovering right around 1 with those confidence intervals. But our best guess is almost across our area, the reproductive number is above 1. In order to interrupt transmission, to keep it low, to keep those cases low, to keep hospitalizations low, and unfortunately to keep mortality low, we need to get that number below 1. And we can do that by doing very simple things like wearing masks, social distancing, and keeping our hands clean. So to conclude, most of the data we shared with you today support the conclusion that we have increased transmission of the virus in our area. And we're seeing those numbers increasing, whether it's those cases or hospitalizations. So this is a reminder also that in order to decrease that transmission, we have to do those really evidence-based, very simple things, such as wearing masks, practicing social distancing, washing our hands, avoiding large gatherings. All of those things can help us decrease transmission, keep the reproductive factor low, keep hospitalizations manageable, and prevent mortality from occurring. So, but it's up to all of us to prevent the spread. No one person can do this on their own. It really does take the entire community to make this happen. And so with that, I'll conclude my remarks and take some questions from the media.
Are you seeing any emerging trends in new positive cases? Are more younger people testing positive? Franklin County reported that a 15-year-old tested positive, as well as 2 people in their 20s and 3 in their 30s.
Yes, we are seeing trends with more young people testing positive. That seems to be the largest proportion of cases that we're seeing right now. Now, the younger populations don't necessarily show up in our hospitalization numbers because typically they're able to handle the virus. It's either a bad cold or sometimes they're even asymptomatic. So sometimes those don't translate into our hospitalization numbers. But definitely the cases are going up in that younger population right now.
In your opinion, what would be the best practice for reopening schools this fall?
Well, that's a complex question to answer. So, really it's organizing those reopening plans or going back to school plans using all of those tools that we've been talking about repeatedly here. And that includes, social distancing as much as you can. I know schools can get fairly crowded, but you have to have plans in place in order to accommodate for that. having adequate hand sanitizer, wearing masks, all of those things in order to prevent transmission amongst the population and amongst the staff and the janitorial staff. All of them need to be practicing all of those evidence-based practices to prevent transmission. But it's a very complicated question, and I know it's one that a lot of people are working on right now, in addition to the youth sports and things like that. And so I've just given sort of a broad framework on these are the things that are sort of the core for that. But really, there's a lot of detail that goes into those plans.
That concludes the list of questions we've received today from members of the media. Thank you for tuning in, and have a wonderful weekend, or have a wonderful afternoon.